right, we're back. Hi, it's Up Grove Hill. Welcome into the very best day of your life. Frank, Mitchell, Tim May, we're here stirring the pot. We had a great interview with Dr. Eric Bush and Laura Cucci from the Hospice of Frederick County. And as you know, if you haven't heard, there is a bill going to be introduced by Senator Ron Young. It's called Death with Dignity. I call it assisted suicide. I feel it's unnecessary, unneeded, not needed. And I think it's just a waste of effort where we have so many important things to take care of, because that's the way it should be. And if I say it, that's the way it should be, then that's the way it should be. And Frank says differently.
No, I would support the bill. And I think the discussion, is nobody that I can imagine would have anything negative to say about hospice. That's not the discussion.
No.
And got somebody on the line maybe who can amplify the point I was making about
It can make some sense out of what you're saying.
Because it's Dave Schmidt.
Dave, what's up, brother?
From Frederick's Forum.
How are you guys?
We could not be better. It's a little bit snowing outside, not bad right now, but everything's good.
Yeah, it doesn't seem like there's much snow left.
I'm glad you mentioned that because I got to butt in for a second. Frederick County has just lifted the snow emergency plan. That just happened. I think they were thinking it would stay till 6, but things have really calmed down. Washington County lifted it a little while ago. So now back to the program.
Thank you, Frank, for taking away all the thunder. Dave, I know your thought process, but go ahead and let's hear what you say about Senator Young's proposed bill.
Well, first, this is something we're actually going to talk about on Saturday. We're going to get into it a little bit deeper, but I was listening and I couldn't let you get away with saying there's no other needed fills. Now, first, I just want to say
there isn't what?
I'm a huge fan of hospice. My grandmother went through it here in Frederick County. Yeah.
Say that again, that you couldn't let him get away with?
I couldn't get away with him saying there wasn't a need that needs to be filled.
Okay.
Right.
Okay. So
that's a fact.
A big fan of hospice. My grandmother went through it here in Frederick County.
Me too.
It was a proverbial godsend.
Amen.
It was a wonderful experience. So, but the question you asked
did Grandma want
hospice is good.
Did Grandma want a suicide pill?
The question you asked was whether or not we should allow people to die with dignity in Maryland. And so
they do die with dignity.
And we can talk about all sorts of anecdotal stories about people that got well and all. But let me tell you one of hundreds of stories. There was a young lady. She was 31. She got diagnosed with a brain tumor.
Yes.
14-hour surgery, radiation. For years, she was getting better. It was a good thing.
Okay.
She knew that the odds of living long weren't going to happen, but you know what? She was living a good quality life.
Okay.
And then, in about, I believe it was 99, the tumor started to grow again. Okay, so she went through a devastating, I would say, second phase of this, where her health was going down.
Sure.
There was pain. She was starting to lose her motor skills, and it was
Without
a horrible
question.
time in her life.
Without question.
So the problem was the type of brain tumor she had was not necessarily going to kill her within 6 months or a year, anything like that. There potentially would have been 2, 3, 4 more years of this. And so eventually it got to the point where she couldn't take care of herself.
Okay.
She was falling down in the bathroom. She's covered in her own matter, all of sorts of things she hasn't been taken care of. And she's looking forward at potentially months or years of slowly regressing into, her words, not mine, because she wrote an article during this time, of being a vegetable.
Okay.
And so where in a hospital, in hospice, any of this, where is there the ability? Thankfully, she lived in a state where she had the ability to say, while she still had dignity, she was able to gather a family, decide on a date, and say, I'm going to die with dignity before I'm sitting there trapped in my own body for months or even years. Because again, under traditional medical care, they have to do what they have to keep her alive. So she would have been.
She could have chose not to have that medical care.
She could have, but still, even then, months or years.
Well, I think
her passing into a situation where she can't even control her own body, and she got to decide that. So the question here shouldn't be whether or not we're allowing people to die with dignity. It should be regulation. There should be all sorts of discussion about, how do these drugs get administered. But I cannot imagine that you believe it's either more ethical or more moral to allow someone like that. And that's one of hundreds of stories.
Well, the point is, but Dave, the part you're leaving out, she doesn't. Here's the part that hospice, that Dr. Bush brought out. First of all, a lot of time people suffer a lot more because they go for any kind of treatment that they think can help them, and they put their bodies through this, and that's their choice, and they have a right to do that, and they go through all kinds of chemos, and they come back with radiations, and they put themselves through hell. And I agree with you, but that's their choice to do so. Now,
but Tim, I'm not talking about random cases of people over-medicated. I'm talking about the specific woman,
right? And I'm with you on that.
Going to neurologically continue to progress alive. Because her body was able to feed itself. She was going to progress to the point where she couldn't handle herself. She couldn't take care of herself.
Correct.
She would have been trapped in her own body.
Correct.
How is it more merciful?
Because she could have lived her last days without pain. She could have lived her last days without suffering, and she could have lived with dignity until her time of passing occurred. It sounds to me like this person put them through tremendous hell, and their family through tremendous hell. And the doctors, as you said so correctly, they have to continue to do what the patient wants, no matter how futile it is. I've seen so many people in that identical situation that you're talking about. But I have seen those identical people be placed into palliative care where there is no pain, there is no suffering. And that's the decision you can make.
I'm not talking about 3 months, I'm talking about 6 months, because all of the hospice allows for up to 6 months, et cetera. What I'm saying is, you're going to tell me that it's more ethical or more moral to allow somebody in that situation to decide in their life, while she is still able to communicate, while she's still able to talk to her friends and family, while she still is, she looks still good and with dignity, and she doesn't want them to remember her as we see cancer patients, et cetera. You're going to tell me that it is more ethical to put her through, because she's
putting herself through it, Dave.
No, I'm not saying that more medical care would have allowed her to live longer. I'm saying that she was going to live for a long time. Even without any kind of, I'm saying laying there in a bed stuck in her own body.
Suppose, Dave, that a person is to the point where they don't have that problem, that they decide they don't want to live any longer because they've just been diagnosed with the cancer, and they've seen their friends and what shape they're in, and they don't want to go through that. And, they then choose to say to the doctor, I'd like to have the suicide pill. I think it's immoral.
I think that is absolutely your sovereign right as your own person to make that decision. And you make that decision, you can't just walk into a doctor's office and say, give it to me. No. There has to be some kind of regulation. There has to be a process you have to go through to prove that this isn't somebody who's delusional, this isn't somebody who has mental problems or something proven. But if you walk in and you are facing a horrible, horrible 6 months, year, 2 years, 10 years in front of you, you should have the ability, and thankfully there are states where you can move to, where you can say, look, I want to be prescribed this medication, that if I get to the point where I'm laying in my bathroom covered in feces, and I have to be cleaned up by someone else, that I can say, you know what, I'm going to take my medicine at night, and I'm going to choose to finish this path that I'm on.
But that individual has chosen to live that way. She has chosen. She didn't choose her disease. She didn't choose to be in this hell of a shape that she's in. But she can also not be in that position. She does not. She can be taken care of, and that's the sadness, is that people have lost hope. God forbid if I can't imagine how the family's going to feel. They're not going to be happy that my daughter, my son, or my granddad, or my father, he killed himself. Well, the death with dignity. You can live life with dignity, and you can die with dignity, and it does not have to be coming on the size of a suicide.
This is the only choice she has left. She doesn't have a choice to whether or not her body or her mind's going to work anymore in days, months, or years, but she can choose to finish the path that she's on, and I just think that that's the more ethical, more moral. So you had asked if there was a need that needed to be filled, and that's what that's say I.
Okay, Dave, I always appreciate it, and I hope that you have the counter side on Saturday to this assisted suicide bill.
Of course.
Appreciate it.
Take care, guys.
Got it. We're going to take a short break and then back with your phone calls, and it's fascinating. It is fascinating. I think, and I'm not changing my mind, not that I need to change my mind, I just believe that we have death with dignity, and it's called lots of things. Pain and palliative care. It's called hospice at times. You do not have to commit suicide to get out of pain. We'll be right back. Free Talk Radio, 930 WFMD.